and thank you for joining us today for the first briefing of 2021. You know that I am a positive and optimistic person, and I am very hopeful for the new year as we work to get every Pennsylvanian who wants a vaccine immunized and work to end COVID-19 and its impact on our Commonwealth and our country. This morning, as of 7 a.m., there are 5,529 patients hospitalized due to COVID-19. 1,149 of those patients are in the intensive care unit, and 674 of those patients require breathing assistance with a ventilator. The trend in the 14-day moving average of the number of hospitalized patients per day has increased by more than 5,400 since September. But the good news is that this has started to come down a bit. Our hospitals and healthcare systems continue to be significantly challenged, but they are maintaining excellent patient services and care. They need all of us now more than ever to follow the masking, social distancing, and hand-washing protocols that we have been stressing since the beginning of the pandemic. We need to do this to make sure that our healthcare systems are not overwhelmed and that there are people available to care for us if we get sick. Before I go to the current case counts, I want to highlight that on Sunday, we did technical maintenance to our NEDS database. This is the main database that we use for reporting of COVID-19 cases. The case counts reported Sunday and today are abnormally low as a result, and we believe that they may be somewhat higher than normal tomorrow. On Sunday, we recorded 4,579 new cases of COVID-19, and today we are reporting 3,226 new cases. These totals bring our statewide total to 665,097 total cases of COVID-19 since the beginning of the pandemic. Now, the technical maintenance we performed did not impact our electronic death reporting system, which is where we get the data related to deaths attributed to COVID-19. However, we do anticipate a lag in reporting over the holiday, and that this number may be somewhat low now and will increase during the week. On Sunday, we reported 56 deaths, and today we are reporting 66 deaths. And that brings our total to 16,361 deaths attributed to COVID-19 since the beginning of the pandemic. The statewide percent positivity, as reported on the early warning monitoring dashboard, is now 15% statewide, and this continues to represent a slight decrease from last week. Although this is encouraging, we do report significant decreases in participations with our case investigations and contact tracing. Now, throughout the pandemic, there have been 52,917 cases of COVID-19 among children 5 to 18 years of age. That is an increase of 3,929 COVID-19 cases within that age group in the last week. This again underscores the need for all of us to do our part to stop the spread, wearing a mask, washing hands, and social distancing. I also want to remind parents and caregivers in school districts that anyone over the age of 13 can now use the COVID Alert mobile app, which is an excellent tool for contact tracing as students head back to school after the holiday break. Nationally, we expect the vaccination efforts to move into high gear now in the new year. Our latest report from today in Pennsylvania is that 135,044 Pennsylvanians have been vaccinated. In addition, CVS and Walgreens have completed vaccinations at 115 skilled nursing facilities. We are actually waiting on the report from the Federal Partnership Program on exactly how many people were vaccinated at these clinics and which ones. Now, this week, Pennsylvania is slated to receive 166,725 doses of the Pfizer vaccine. Now, 97,500 of those doses are for the second dose for the healthcare personnel who received their first dose 3 weeks ago. 30,225 doses are for healthcare facilities to vaccinate healthcare personnel in Phase 1A, and 39,000 doses are for the Federal Pharmacy Partnership to vaccinate skilled nursing facilities. We also anticipate approximately 80,000 doses of the Moderna vaccine this week. Vaccine providers are also setting up systems to vaccinate healthcare providers who are not necessarily associated with their healthcare system or hospital. Last week, I ordered vaccine providers to set aside at least 10% of their vaccine to immunize these critical healthcare workers. That could include EMS workers and others. This order goes into effect January 6th, and each vaccine provider must provide a contact for these non-affiliated healthcare personnel to register to receive the vaccine. Many locations, of course, receiving the vaccine have voluntarily begun vaccinating these providers, and we are thankful for their efforts. Now, it is important to remember that our vaccine allocation from the federal government does fluctuate from week to week, as well as the delivery schedule, all through Operation Warp Speed. This does make planning challenging, but it also increases the amount of time it takes to administer the vaccine. Our healthcare heroes who are working to vaccinate critical healthcare personnel are also, of course, caring for patients who are currently in the hospital. We know it is hard to ask people to be patient as we take on this unprecedented task, but patience is exactly what we need. Please continue to wear a mask, wash your hands, and social distance to avoid becoming infected with COVID-19 and to stop the spread. Download the COVID Alert app to make sure that you get an exposure alert notification if you have been exposed to someone with COVID-19. Avoid social gatherings, even small gatherings, which can spread COVID-19. You can visit the vaccine section of our COVID-19 website to see the latest updates to the vaccination plan. Now, please remember, as we continue through the vaccination process, it still will take months before the manufacturers, Pfizer and Moderna, produce enough vaccine to immunize the general public. This makes the mitigation measures that we have been discussing more important than ever. Now, the mitigation orders that the governor put in place for over the holidays expire this morning, but there is still a stay-at-home advisory in place for all of Pennsylvania. Masking orders that were in place prior to December 12th remain in place. We cannot let our guard down. We must continue to follow and to demonstrate our personal and collective responsibility to each other to prevent the spread of this virus. Thank you, and I'm very pleased to answer questions.
Thank you, Secretary. Our first question is from Ford Turner from the Morning Call. Ford, go ahead and unmute yourself.
Hi, Dr. Levine. Can you tell me what the best place is online, either on the Department of Health website or some other location, if someone in the public, a researcher, whoever, wanted to find out how many people died of COVID on December 8th or November 27th or some certain date, not the number of deaths the state reported to the public that day, but the number of people who actually died that day?
So that is a challenge in terms of ours. So I'm going to actually ask April Hutchinson, our communications director, to respond to you later to give you where that is in terms of the website. The numbers we report. So last week we reported 300 and a little over 300 deaths. Of course, that's not the number of people that passed on that day. That's the number of people that were reported that day. And it goes back often about 7 to 10 days. So there are places in our website. I don't have the location at my fingertips, but we'll have our communications team get back to you with where that location is.
Next up is Justin Switzer from PLS. Go ahead, Justin.
Hi, Dr. Levine. Thanks for doing this today. As far as the end of 2020, the number of vaccines administered nationally has been lower what the federal government had initially predicted. I was curious if you could walk me through from, a statewide perspective, how efficient you think the rollout has been and, any recommendations you may have on what the federal government can do better to help states administer and distribute the vaccine.
Sure, thank you. So I really think that some of the estimates from the federal government, especially estimates during the holidays, were higher than they should have been. I think it was always going to be a challenge during those 2 to 3 weeks to be able to administer the vaccines that were sent to us. Remember, there's also somewhat of a difference between what they think that they're going to be able to allocate to us, what their preparations are, and then actually how much vaccine we actually get. So I think you're going to find in Pennsylvania and throughout the United States that now that the holidays are over, that things are going to be gearing up. We're focusing on 2 missions. One is both in 1A. We are focusing on the healthcare workers, which will include hospitals and health systems, as well as FQHCs and our county municipal health department partners. And then we're going to be working on the vaccine partnership program with Walgreens and CVS to be vaccinating nursing homes, and then other long-term care facilities. Again, that data has been slow to get to us about that mission, so we're hoping to be able to put all that together this week. I think that it's going to gear up a lot, but I think that one thing that we really need is the funding that actually has now been allocated in the recent bill signed by the president. So there was approximately $6 to $8 billion that we should anticipate for the vaccine distribution and administration effort to the states, territories, and cities involved with this. Because as we move on from 1A to 1B and 1C, we're going to need to start mass vaccination clinics. We're going to need that money to actually contract with healthcare workers to be able to do that, and the money will be essential. So I think that one of the things is to be careful not to overpromise, and the second is we're going to need that funding recently authorized by Congress and signed by the president.
And just a quick follow-up, if I may. If the rollout moves too slowly, is there a risk that these vaccines will expire?
So I think that we're going to do everything we possibly can to prevent that. For example, there have been instances in the country, and I know of at least one in Pennsylvania, where one of the pharmacies, so whether it's CVS or Walgreens, went to a long-term care facility. They actually came with a certain number of doses, but they didn't use all those doses. And then they called us, or they called other state health departments for other states, and we were able to get those doses administered to actually EMS workers. So I think that we're going to do everything we possibly can to make sure that none of those doses expire. We absolutely need to get vaccines into arms. It's not the vaccines that's the issue, it's the vaccinations that's the issue. And I think that we'll need to be flexible and nimble to be able to accomplish that.
Next up is Jamie Bittner from Fox 43. Jamie, go ahead and unmute yourself.
Hi, Dr. Levine. I had 2 questions for you today, if you don't mind.
Sure.
My first question was, I was hearing reports that the FDA was possibly looking into splitting the dosages of Moderna. Have you heard anything about that, and what are your thoughts on that? Because that would be more vaccinations that would have to be given out, but it would make it more available to a wider group of people. And number 2, I had a question on why the state is not utilizing more local pharmacists to give out these dosages of vaccines in order to speed up this process.
Sure. So first, in terms of the FDA, we'll wait to see. I know that was discussed in the press, but we'll see what the FDA and the CDC say. I think that it'll be important to follow the science. As I know, England has taken a different tact in the United Kingdom, but I think it's, from my perspective, important to follow the science in terms of making sure that people get their second doses of both the Pfizer and Moderna vaccine. That's how it was studied. And at least right now, to give the full doses of both vaccines at both times. Now, if the FDA and the CDC have different data and potentially new data from the pharmaceutical companies, then we'll see. But right now, we are sticking with the specific recommendations. We are using some local pharmacies to be able to immunize, for instance, healthcare workers in certain areas, and we'll be using local pharmacies much more. In fact, there's a specific federal partnership with many pharmacies to use them as we roll out phase 1B and 1C, and are immunizing larger populations, not in the general public, but among those priority groups. Right now, it was Operation Warp Speed that contracted with Walgreens and CVS for that mission. That had nothing to do with the state of Pennsylvania.
Next up is Flora Pastorera with PennWatch. Flora, go ahead.
Thank you. Good morning. I also have two questions. Secretary, at first, could you just give us how you thought the holiday went in terms of asking people to stay home and not travel? What's your assessment of how the Christmas and New Year's holiday went?
So let's do that first. It's very hard for me to say that. I mean, we do know that there were a large amount of people who did travel, but in terms of how many people stayed at home within their household, or how many people might have had smaller gatherings, I have no way to assess that. So, what we need to do now is to continue all the mitigation efforts that I discussed, to stay at home, not participate in large and small gatherings, and we'll be watching our numbers really closely to see if there's a holiday bump or not.
All right. And my next question, the indoor dining resumed at restaurants, but we still have restrictions in place in terms of a last call at 11 p.m. and not having the ability to sit at a bar, or you have to order food to get a drink. When will those restrictions be lifted?
Again, it's impossible for me to predict the future. We're going to have to see how our case counts go. We're going to be observing to see if we have, unfortunately, an increase due to the holidays or not. And then as we see how our case counts, particularly our hospitalizations are impacted, then I'm sure that the Department of Health and the governor's office will be discussing that. But it's impossible for me to give you any time period.
Next up is Crispin Havener from WJAC. Go ahead, Crispin.
Good morning, Dr. Levine. I guess I'll pick up kind of on what Flora was kind of asking. As we enter this new year with the new vaccines, a lot of citizens are optimistic as we enter this new year that maybe later this year we'll return to life as normal with crowded restaurants, no masks, full stadiums. But from your perspective, what will it take to get all of the restrictions that the state began to put in back in March lifted? Is this something where cases would have to be at a certain acceptable level that hospitals can handle the situation and vaccinations at a certain threshold, or would this be only something that we see when daily cases are close to zero?
Well, so again, I don't have a prediction of sort of when that will happen, and I certainly don't have a specific metric when further mitigation orders might be lifted. The ones today were just lifted this morning, and again, we just finished with the holidays. So, but I also remain very positive and optimistic about the rollout of the vaccine and how it's going to gear up, and we'll be immunizing through our phases of 1A, 1B, 1C, and then eventually the general public. There are many variables that will determine how fast the vaccination program goes. The biggest one is how much vaccine we get, both from those manufacturers and then potentially other vaccines, the AstraZeneca vaccine, as well as the Johnson & Johnson vaccine, and then there's a new vaccine that has just started clinical trials. So, of course, the more vaccines that are safe and effective that you can roll out, the faster that will go. Very hard to predict the future, but I do remain positive and optimistic.
And I'll follow up with that. I'm based in a more of a rural region in, say, Pittsburgh and Philadelphia and, central Pennsylvania, Cambria, Somerset, Bedford. Those counties have really been hit hard in recent weeks in terms of their rates. Are you concerned that some of these rural areas maybe haven't been picking up the message as much, and that is why we've been seeing such a higher caseload in this region, especially compared to the first time around back in March and April? Maybe we were a lot more complacent because our rates were lower in that first wave.
Well, so, we have had widespread community transmission of COVID-19 really throughout Pennsylvania. And so this has affected large cities, as you said, such as Pittsburgh and Philadelphia. It has impacted smaller cities such as Harrisburg and Lancaster, Allentown, York, et cetera, and has significantly impacted rural areas. We certainly saw that throughout the country. Some of the hardest hit states were South Dakota, North Dakota, Nebraska, Minnesota, Wisconsin, very rural states. And so rural areas are not immune to this virus. And if you had widespread community transmission in rural areas, you're going to see a lot of cases.
Next up is Bill Kibler from the Altoona Mirror. Bill, go ahead and unmute.
Thank you. Could you give some details on the decline in cooperation with case investigations and contact tracing? And can you say why it may be happening?
Sure. I don't have specific details. Often Director Huff, I don't know if he has a press conference. Yeah, he'll have a press conference this week. And so often he has more specific details about, with the numbers about case investigations and contact tracing. I mean, I think one reason why it's really challenging is just the numbers that we've had. I mean, when you have 7, 8, 10,000 new cases a day, it's not going to be possible to reach all those people. And so what we have to do is prioritize, and of course we prioritize outbreaks and congregate settings, such as nursing homes, other long-term care facilities, schools, et cetera. But our cooperation, continues to be a challenge in terms of people answering the phone and in terms of people giving us the depth of information that we need to be able to get that data and see trends. So we're hoping that people first download the app so that the information is automatic, but also people, we're really asking for people to cooperate with us so we can stop the spread.
Thank you.
Next up is Jennifer Learn-Andes from the Times Leader. Jennifer, go ahead and unmute.
Oh, I was wondering if you can provide any more specific information in Luzerne County. For example, the cases have been high and some that's been attributed to the state prison. Do you have any more detailed breakdown?
I actually don't at my fingertips have any specific breakdown. A lot of that is available on our website, or if you call our communications office, we might be able to get you some more specific details about Luzerne County.
Next up is Erin McCarthy from the Philadelphia Inquirer. Erin, go ahead and unmute yourself.
Hi, Dr. Levine. Thank you so much again for taking the time to chat today. I know it's difficult to plan with Operation Warp Speed and not knowing how many doses you're going to get in a certain week. But with Phase 1B approaching, is Pennsylvania prepared to get the vaccine to people over the age of 75 and essential frontline workers? I know you mentioned today mass vaccination clinics. New Jersey has already named locations for these sites. Can you provide more clarity on what you're planning and what people in that next group should do or shouldn't do right now?
Sure. So we are working on those plans right now. So I don't have specific details for you, and we will provide specific details when we have them. But all of that work is providing now. I think what those individuals should do is to protect themselves as much as possible with all of the measures that we have been discussing. Keep in contact with their doctor and watch in terms of our notifications. And as soon as we have information about when that will start and how it will start and where it will start, we will provide you and everyone else with that information.
And perhaps this falls under the same category of not knowing yet, but in terms of staffing for mass vaccination clinics or however the vaccine gets out, do you have any ballpark of how many more individuals you'll need getting the vaccines into the arms of those people? And does the state have the money to hire additional staff, or how hard is it to train people to to give a vaccine?
So you're correct. This is a significant challenge, and so we're going to need to work with pharmacies, as was discussed, with other healthcare personnel, with our county municipal health department partners, with FQHCs, with volunteers. But I think we're going to need to contract with agencies to be able to have those mass clinics that will take funding. And so we are very much looking forward to the funding being available from the recent stimulus package, which will help us. If that money isn't available, we'll work on exactly how we're going to fund it. But that mission will proceed, and I'm confident it'll be successful.
Next up is Stephanie Stahl from CBS 3 Philly. Stephanie, go ahead and unmute yourself.
Hi, Dr. Levine. Thanks for talking to us. I have two questions. When is 1B and 1C going to start? And I know you said the state is working on it. Many other states have released details on the next round of vaccinations. Why does Pennsylvania appear to be so far behind on this?
I wouldn't say that we're far behind. Again, 1A just started several weeks ago, and we're just working to ramp up 1A. And so we're not really behind in any way. So I can't tell you when B will start. It'll totally depend upon how much vaccine we get and ramping up our efforts for 1A. But as we come to when 1B will start, I promise you we will be ready. We'll have all the resources that we need, and we'll have all the plans that we need to start that. But we're not there yet, and those discussions are happening right now.
Next up is Chris Mamula. Chris, go ahead and unmute.
Thank you, Secretary, for being available today. I appreciate it. I was wondering if you could provide some information on the hospitals and clinics, pharmacies sign up to be distribution points, to be places where you can get vaccines.
I don't know. I mean, we have a list of all the hospitals, et cetera, that are administering vaccine, I believe, as well as the FQHCs on our website. So we have that information on our website. I'm seeing April shake her head yes, so that's good. So all of that information is available on the website about where those vaccines can have. Remember, we're asking the hospitals to have a system by Wednesday, the 6th, so that healthcare workers outside of those hospitals and healthcare systems can sign up to get vaccines. Now, remember, we're asking the hospitals to allocate at least 10% for that mission, and they're going to need to sort of relook at their prioritization schedule as they incorporate those individuals. It is very important for the hospitals to realize, though, that they will eventually get enough vaccine for their entire personnel. So we're not going to hold them short as we continue this mission. So it will give them whatever it takes to be able to immunize their workers, as well as the local workers that we're asking them to take on, as well as the FQHCs and pharmacies, et cetera. And those first in line should be individuals in the healthcare personnel that are frontline, meaning they are seeing patients with diagnosed or suspected COVID-19. And then other healthcare workers will come after.
One last question, Secretary, if I could.
Sure.
As far as the general public kind of vaccination, I realize we're months away from that, but for these institutions, for these hospitals and pharmacies and other healthcare providers to sign up by the 6th, I guess, to be allowed to do that. Can you talk a little bit about how that's going to work? I mean, will everyone enroll for a vaccine? Is that how it's envisioned?
Yes, so we do anticipate as we go on to 1B and 1C, which was discussed, and then eventually phase 2 with the general public, we'll want people to sign up to be able to get the vaccine. We're not going to really want people to queue up in line, which could stretch for a long period of time, and then of course you might have lack of social distancing, et cetera. So we'll have an information system so that people can sign up and have an appointment to go to the vaccination clinic, or maybe go to their local pharmacy, or maybe their clinic or their healthcare provider to have a specific time where they get the vaccine, and then you have to wait at least 15 minutes after the vaccine to make sure there's no problem, and then you can go. And so it'll be really important not just to have large groups of people waiting in line to get the vaccines. We're going to have a system set up when we're there to accomplish that.
Our last question today is with David Wenner from Penn Live. David, go ahead.
Thanks, Dr. Levine. Does the health department know what the level of refusal or the level of healthcare workers who are declining the vaccine?
I do
What's
not.
the level of?
Yeah, I don't have specific numbers. Sorry to interrupt you. I don't have specific numbers. We have heard that there have been some healthcare workers that have declined. Of course, they don't show up and then decline. They just don't sign up with their system to get the vaccine. We have heard that some workers in long-term care facilities have declined. It is so important for everyone to realize that these vaccines have gone through very rigorous testing by their manufacturers. This has all been reviewed in great detail by the FDA and the CDC. And so these vaccines are safe and they're effective. And it'll be critically important for people to sign up and to get the vaccine and get their second dose for these vaccines so that we can eventually stop the spread and get past COVID-19. So I would encourage everyone that if you have the ability to get the vaccine as part of 1A now and other phases later, please do so, because that's how we're going to stop the spread in the Commonwealth.
Thank you, Secretary. That concludes today's press briefing. A copy of this briefing will be available later today on pacast.com. Thank you.